Today we're going to talk about active assisted bed mobility. So this is mobility in the bed. The patient uses either all four limbs or at least lower extremities. You use a low back sling like this. It only supports the patient at his trunk, and slider sheets on the bed underneath him to help with friction. So we have a couple of different options for slider sheets. We've got plastic slider sheets. They come in different colors, usually folded, sometimes rolled, and you can cut the amount off that you need, the size off that you need. We've also got these cloth, non-disposable slider sheets, and for our demonstration today, this is what I will be using. Of course, if this was a one-person job and you were turning your patient to place the sling, you definitely would have the side rail on the opposite side of the bed up. For our demonstration purposes, we'll be safe. Okay, Mr. Turner, can you roll over onto that side? Bend this knee, there you go. You place this sling right at the small of the back for lumbar support. Big bump to roll over, come back towards me. This is a pretty important movement to have the sling centered. Okay. Now can you bend your knees? Get these leg straps good, thank you. You still cross the leg straps. Place the slider sheet where you'll be able to access it. Like with any other transfer, any other sling, you're going to attach the top straps first, top loops. Secure everything so nothing will hit your patient in the face. For this movement, this strap will be completely under the patient's arms, right around his trunk. So at first you can instruct your patient to hold on to the lift bar, and I'm going to sit you up. If it becomes a far reach for his arms, and it looks like it's going to be an uncomfortable position, then you can instruct the patient either to hold on to these straps or cross his arms. So this is going to sit him into an upright sitting position. Yeah, you are going to have to hold on to that to pull yourself up into a sitting position. So for this exercise, your patient does have to have some upper body strength. Put your elbows on the outside if you can. Yeah, there you go. I'm going to lift the patient so that he is suspended and so that I can place the slider sheet. Now, what's the comfort level with this sling?
Good.
It's okay?
Good.
Okay. No pressure points or, okay, sore spots, good. I do usually ask my patients how the sling feels, how it's positioned, is it causing any pain? I'm going to fold the slider sheet in half, position it under the patient's bottom. And then I'm going to lower the patient back down so that he is making contact. Now, there's going to be more active use for the patient's lower extremities. For now, holding on up here is fine. Otherwise, you can also have him pushing on the bed. So you can have him actually using his hands with his feet, and I want you to turn over to that edge of the bed there. So this is an active transfer. It's not passive. I did not, there was some assistance. That's why it's active assisted, but the patient was definitely using muscle. So now, Mr. Turner, I want you to use your hands on the sides of the bed. There you go. Come around so that you're in front of your patient. And I can lower this lift down far enough that it's not holding the patient up to challenge sitting balance. Doing okay? Okay. Then you can have your patient lean to one side or the other to grade sitting balance. Good, so more than a couple inches. No sternal precautions because he's pushing out to the side. You know what? I think that it would be better if you were facing the other direction and you could see out the window. All right. So wherever your hands are most comfortable, holding the strap or the lift, I'm going to raise you up again. Or you can use your hands on the bed. It does push your patient back a little bit. It kind of retropulses them. I'm going to actually lower the bed instead of raising him up more. Then I'm going to instruct the patient to put his feet back up onto the bed, assisting as needed. Good. Walk to the other side of the bed. Challenging and making it easier, so I'm grading the activity to the patient's ability during movement. Lower this more. This is going to be the area of instability, anterior. So I'm going to position myself in front of the patient because if he starts to lean anteriorly, I want to be able to push him back. Good. And now, yes, you can sit back. Even if the patient were to lose balance to the posterior side, I would be able to adjust him with either manually or with the lift. Okay, the other really good use for this activity is, I'm going to lift the patient back up and have him back into a supine position. All right, let's get your feet back up on the bed, Mr. Turner. Way too down. And your patient will be able to tell you, I'm not sliding as easily, it's harder this direction. Yes. There we go. Now I'm going to ask the patient to walk himself up to the head of the bed. Full quad engagement for that activity. And then I'm going to ask the patient to walk back down to the foot of the bed. Kind of fun. Yeah. And that's the report you get from your patients. This is an activity that's enjoyable for them. They feel a little bit more safe maybe than they do just standing up from the bed. And back down. We'll do that a couple more times. Great trunk and great leg exercise. Very active. So now just to make the job easier for me, I'm going to remove this sling. I'm going to remove the slider sheet, not the sling, before I lower the patient back down into a supine position. Are you a little too high? Okay. Scoot down a little. Okay, you good. And that is active assisted bed mobility.